I discovered I had a heart problem in October of 2005. I couldn't breathe, my lips were turning blue, my fingernails were turning blue, so I had asked my husband to take me to the hospital. The pulmonologist told me there was nothing wrong with me. The cardiologist told me there was something wrong with me. So basically, after leaving that hospital and another hospital, I got here to North Beth, Israel. That's when they told me I had an enlarged heart and a double lung infection. So I really, really wanted to have a child, so I decided that whatever I had to do to have this child, I was going to do. So when I was diagnosed with needing a heart transplant, I didn't think twice about it.
So the heart transplant team, led by surgeon Dr. Margarita Camacho, completed a successful transplant on Stefania with the goal of someday having a child.
The first thing, I wasn't thinking to get pregnant right away. I was thinking about taking care of myself and making sure that the graftings were good.
I gave her a call and she said, I really don't want you to be mad, but I'm pregnant, about 3 weeks pregnant. And we had just seen her for a biopsy a couple of weeks before. And I told her, I said, look, I can't make these decisions for you. I said, but, I'll work with you.
By our measures, becoming pregnant within 16 months of a heart transplant makes itself quite high risk because we are in a totally uncharted territory. She initially thought that since I have a new heart, everything is going to be fine. But when she found out that she is carrying twins, she was quite surprised.
They told us that children would have twin-to-twin syndrome, which is a disease of the placenta, that the kids are not sharing the placenta equally. So I decided to do the surgery, which was to separate the placenta.
Fortunately, the procedure was successful, but it left a very small portion of the placenta for the smaller baby, and therefore we had to monitor the growth and development of these babies very closely.
But the delivery was great. We had a whole team, and my doctor set up in the main OR. We had a bunch of nurses and a great anesthesiologist, and him and two of his co-workers did the C-section, and everything is great.
On December 29th, twin girls were born to the DeMeos, Melania weighing 4 pounds and 2 ounces, and Natalia weighing 2 pounds and 13 ounces. Born 6 weeks premature due to complications related to twin-to-twin fetal transfusion syndrome, both were cared for at the neonatal intensive care unit until they were healthy enough to go home. These two babies benefited from a multidisciplinary approach.
In my 25 years of taking care of high-risk pregnancies, this was one of the best day that we had on that day.
I owe this hospital my life. I owe these doctors everything. Everywhere from the staff, the nurses, to everybody. Even people who check you in. This has been the best experience, and if I can have to say anything about it, I would suggest anybody to come here, because this hospital has been nothing but a miracle to me and my family.